First, we'll start with goals for the patient. Ren wishes to reduce the pain and swelling of her right calf, heal from this injury, and return to her work on the farm as soon as possible. Ren usually walks around 6 miles on the farm daily, and she hopes that she'll be able to achieve this level of movement after treatments. Her previous doctor suggests she wear boots, but this is not practical on the field, and she wishes not to adopt this type of plan. Ren is starting to feel ashamed and stressed about her lack of production and not being able to get everything done each day. She hopes that she can return to the normal track of life. Second, we'll go over with care and rehabilitation plan. Ren's range of movement include knee flexion with a measurement of 120 degrees, ankle plantar flexion of 50 degrees, and ankle dorsiflexion of 13.5 degrees. Ren is experiencing a second-grade calf muscle tear. It occurs when the fibers in the calf muscle rupture due to excessive stress or force. The calf comprises two main muscles, the gastrocnemius and the soleus. Symptoms of a calf tear include sharp pain, swelling, bruising, and difficulty walking, and those symptoms all apply to Ren's condition. A second-grade calf muscle tear takes about 6 to 8 weeks for a full recovery. Treatment for torn calf muscle has 3 phases throughout. First is the inflammatory phase. It will help to stop the bleeding of muscles. Rest, ice, compression, and elevation are the basic treatment plan of this phase. But it is not recommended to take anti-inflammatory medications for Ren because it can slow down the healing process, which opposes her wish of getting back to the field as soon as possible. The second phase is the proliferation phase. In this phase, the muscle will begin to create scar tissue at the injury site, essentially kneading the muscle back together, and it takes around 3 to 4 weeks. It is important to avoid any excess movement of the muscle in the first 2 stages, because it can easily cause a development to a more severe grade of muscle tear. Gentle range of movement exercises can be introduced in the proliferation phase. The remodeling phase is the final stage of recovery, where the muscle tissue forms the functional tissue. This phase includes more advanced strength, stability, and functional exercises than the proliferation phase, since it prepares the muscles for a return to normal activities. Ren will be needing a physical therapist for rehabilitation. For rehabilitation during the remodeling phase of healing, 2 sessions per week should be expected, and Ren should be doing stretching exercises at least every other day at home. There are 2 major portions of calf rehabilitation: calf muscle stretches and calf muscle strength training, and stretching exercises usually come before the strength training. One way to stretch the calf muscles is to stand facing a wall with both hands on the wall. Put one leg a step behind the other leg with your toes pointing forward. Keep your back leg straight and your back heel on the floor. And bend your front knee slightly until you feel a stretch in the calf of your back leg. Stretch for 15 to 30 seconds each time and repeat 2 to 4 times each day. Another stretch is similar to the one stated above, but with your back leg slightly bent, which can stretch the bottom part of your calf. Some calf strength training include ankle plantar flexion, ankle dorsiflexion, and toe walk. Ankle plantar flexion is to sit with your injured leg straight and resting on the floor. With your other leg bent, flex your foot off your injured leg downward so your toes are pointing away from your body. Then slightly relax your foot. Repeat 8 to 12 times a day. Ankle dorsiflexion is similar to the ankle plantar flexion, but you should flex your foot back instead, so your toes point upward towards your head. Toe walks is to walk forward with your heels off the ground, balancing on the balls of your feet. Walk for 30 seconds to 1 minute. Repeat 3 to 5 times a day. Last but not least, there are other modifications Ren may need to undertake for her lifestyle even after recovering fully from her injury. This calf muscle tear that Ren experienced is largely due to the overuse of calf muscles. It is suggested that Ren reduces the mileage she walks on the field each day, which further reduces the tension in her calf muscles. Although it is understandable that Ren's desire to be productive to her best ability, it is also important to take care of her own health. Thus, taking a little step back and making some adjustment to her lifestyle might be the best option for her.